A hospital on the brink.
At the end of the day, something has to give. We can't keep doing this forever.
The Northern Territory's biggest and busiest health facility in its own emergency.
We're working under an emergency management type of condition. You could call it even disaster services when you're actually going above and beyond what you actually prepare to do on a normal basis.
Inside the hospital walls, a nightmare is playing out for some patients.
We didn't sleep for 2 days.
Disability pensioner Deb Jones was recently admitted to Royal Darwin's emergency ward in severe pain from a chronic health condition. She became one of many sharing a single cubicle with another patient, a problem known as double bunking.
It's horrible because you're having this personal conversation about your personal health and your personal issues, and someone else is listening to what's going on. And it's just total invasion of privacy.
It's not just patients feeling the crush. An internal emergency warning system called a code yellow is triggered when the hospital is too stretched to deliver normal services. Royal Darwin's first ever code yellow was called in 2018. Last financial year, there were 18 of them.
Truth is that we've normalised disaster. The code yellows, whether it's in code yellow or not code yellow, either way, the hospital is still full.
Health officials say the main cause of a code yellow is demand and a lack of beds to cope. On any given day, up to 70 beds are taken by aged care patients with nowhere else to go.
Ultimately, underfunding of aged care is the biggest single factor facing the Northern Territory for our issues with overcrowding and access block.
Patients requiring elective surgeries are paying the price.
I have never been able to get a date. It just keeps getting pushed out and pushed out and pushed out.
Last financial year, the average overdue wait time for elective surgeries in the NT was 391 days, the longest of any jurisdiction. Just 68% of patients were admitted within the clinically recommended time frame.
That has been one of the mitigation strategies that we put in place. We rationalize elective surgery. That gives us access to 8 or 12 beds in that particular day.
Exacerbating services, the Northern Territory has some of the worst health outcomes in the country, due largely to high chronic disease rates in remote Indigenous communities. Aboriginal primary healthcare providers are trying to help prevent hospital admissions, but they too are struggling under the load.
At the moment it takes 2 to 3 weeks for a client to be able to get an appointment with one of our GPs. So that just goes to show the sort of pressure that our clinics are under right now.
Danila Dilber caters to Indigenous people in Greater Darwin, but its chief executive says it's underfunded by $60 million a year, putting the pressure back on Royal Darwin.
The system is designed for all parts of it to be working well, and I think when you see hospitals overloaded, it's a signal that the whole of the system's not working.
NT Health also faces huge challenges from high staff turnover. With the reliance on locum nurses and doctors, the department has overspent its budget every year since 2016, including a $200 million blowout this financial year.
The more we look into this, the more we realise that there is not a magic bullet or a simple solution to a very complex problem.
The NT government says it's rallying the Commonwealth to provide more money to help heal an ailing system from its chronic condition. Jack Hislop, ABC News, Darwin.